It's Women's Wednesday, which means this Wednesday we're taking a look at ways to improve the look of your face, of course, if you want to, specifically facial contouring and facial implants.
And Tracy was nice enough to do all the work for us. I sat down with Dr. Rousso to get the facts.
Dr. Rousso is here with us again today, and one of the things we want to talk about is facial sculpting, and that, you know, just on first mention of it, to me, that sounds like some pretty serious surgery or a serious procedure.
Well, it sounds probably more serious than it is. We do this very commonly in different techniques to improve the face. Sometimes it can be quite serious if it has to do with patients who've had significant trauma to the face, where they've lost some bone structure or they've had some fractures of the face. Then yes, it can be a bigger procedure. But oftentimes we don't have to do this through very big incisions, very small incisions, small pockets that would allow us to place an implant to build up the bone in some area. Typically we'll do it on the cheeks and the chin area. Occasionally, again, if it's a traumatic injury where patients have lost a significant amount of bone, we have some new computer-generated implants that actually can be made using a CAT scan that will tend to make an implant that will be an exact duplicate for the piece of bone that's been missing.
Wow. Now, when we talk about this traumatic bone loss, things like car accidents, I'm guessing, right?
Yes, that's the most common type of injury that we see that has a considerable amount of injury to the bone structure.
So let's say that you do this facial sculpting. What kind of appearance change does that typically give a patient?
Well, it can actually help to fill out the envelope. In other words, patients, as we age, the skin will tend to loosen, tend to sag, and we lose some structure. Typically, the fatty tissue will sag, we'll lose some of that. We need to build it back up again, and we'll use some implants that are made up of a silicone-based material. It's called silastic, and these implants are used to build up the cheeks or the chin. Some people have a congenital deformity or just an absence of the chin. They have a weak chin and they want to build it up. It's a very simple thing to do by building up this area with an implant, made a very small incision under the chin, and bring this forward. So we can really change someone's appearance quite significantly.
So the surgery to do this is not quite as radical as it might sound.
That's right. It may sound like a big procedure, but it can be done through very, very small incisions, very small pockets, place a very precise implant. And this can be done without very much trauma at all. Patients bounce back very, very quickly from these.
You know, if I was going to come and see you, and I was thinking I might want to have that done, what kind of questions would you ask me, or what would you look for to decide if I was a good candidate for that kind of operation?
Well, I think if you have a particular idea of what you want to achieve, whether or not you want to have a bigger cheekbone or a bigger chin, or if you've got some fullness here in the neck area or some fullness here on these folds and you want to have this sculpted, those are important things that we need to know, and then we can then go from there and see if we can give them a realistic idea of what we can achieve. Right. We have a newer technique now where we're actually sculpting the fat on the face using a laser lipolysis system. It's a very small fiber optic laser we place under the skin, and it's a very, very new technique that we're using that helps to precisely remove the fat in an area on the face, and then we can go in and remove that fat.
So we want a little fat in some places.
That's right.
Okay. If I was going to come and see you, I'd probably get this knocked out, right? But there are some places, like maybe around my eyes, I might want to have some.
Well, I think it depends on the particular individual. Some people will have a deficiency in this area of the cheek, and yes, it's very advantageous to build up those areas. Absolutely.
Any discussion of this on the website?
Yes, we have a large section of our website that's devoted to cheek implants, chin implants, things of that nature, and also, of course, the liposuction and sculpting of the face too.
All right. So that's a good place that viewers can go.
Right. Our website is drrousso.com, DRROUSSO.com, and patients can go to our website to get a significant amount of information if they're interested in this.
Dr. Rousso, always glad to have you.
Oh, glad to be here again, Tracy.
Thanks for taking time.
Thank you.
We've got to take a break real quick, and then we've got more of the program. So stay with us. We'll be right back.